Hi, my name's Danny. I'm an EMT from the safest town in America. What's going on today?
It all started when there's a girl come in. She tell me my pizza stink. My pizza not stink. I've been in the business of 35 years. My pizzas are great. It feels like my wife Edna's sitting on my chest. And Edna, she's a no spring chicken. I like my women with meat on them. It just feel like she's sitting there crushing my chest.
Okay, so while I'm getting this information from you, my partner's going to go ahead and get some vital signs for me, okay?
Little bit of trouble breathing too. I guess it started, I don't know, when the jerk got to hear about the 15 minutes ago. Well, yes, I do smoke a bit. It keeps me calm while I'm making my pizzas. And over here, well, yeah, I take some pills. A nitro pills I take. I have not taken any, no. And this one is my Provincol, and this is what I take. Sometimes I get a little short of breath. The doctor doesn't know why. It doesn't tell me nothing. I don't think I have any medical problems. I'm not allergic to nothing, no. Except that there's a girl who come in and tell me my pizza stink. I'm allergic to her. Yes, I'm a 55-year-old man.
All right, so you know what? Why don't you go ahead and take one of those nitroglycerins? You haven't taken any Viagra, Cialis, or...
All right, I take one nitro. Wait, I'm just going to swallow it, right? Not onto my tongue.
Blood pressure's 130/90, so that's good enough to take that nitroglycerin. Your respiratory rate's a little high. It's 26, but, you're having a little chest pain there. And heart rate's 90 and a little irregular, so we're having paramedics come and check you out for that. And your O2 sat is 86%, but you do smoke, so that could be what's causing that as well. All right, and because your O2 sat's a little low, we're going to put you on some oxygen, a nasal cannula. We'll set it at 4 liters per minute, okay? So we're just going to put that right in your nose.
No, I have no bleeding or nothing like that going on. Okay, I take the aspirin too, just to give me them. A little sick to my stomach too. Maybe I'm going to barf. I hope not. I just took the aspirin. I hope I don't barf all over my new floor. I just cleaned this floor. My son is the head cardiologist at the St. Joseph Hospital and Medical Center, and that is where I want to go. Right to St. Joseph's. He'll come in and help me.
All right. So the paramedics are here. We're going to let them take over and check you out, okay, with their heart monitor. All right. We'll see you in the ambulance.
Okay, all right, I'm ready.
Hey, I'm paramedic Kendall Rose from the safest town in America, EMS. While my partner hooks you up to the monitor and checks you out a little more, I'm going to get a report from the EMT. What do you got?